The expanding use of CT scans across the United States has undeniably revolutionized diagnostic medicine. These highly detailed cross-sectional images can detect tumors, internal injuries, and organ damage with a speed and precision that is life-saving in many circumstances. But a newly published study sheds uncomfortable light on a risk that has quietly been growing alongside the increase in their use: a potential link between the radiation from CT scans and a significant portion of annual cancer diagnoses. The research, published in JAMA Internal Medicine, suggests that 103,000 cancer cases each year, equivalent to 5% of all U.S. diagnoses, may be attributed to CT imaging alone. This startling figure isn't based on conjecture. It comes from projections using hospital data across 20 states, examining a staggering 93 million CT scans performed in a single year. To put this in perspective, CT scans are now being considered as potentially significant a cancer risk as alcohol or obesity, both of which are already the subjects of major public health campaigns. And yet, CT scans continue to be administered with varying doses of ionizing radiation, often without standardized protocols or sufficient consideration of necessity. The danger lies not just in the frequency of CT scans, but in how casually they are often used. Medical imaging has become so normalized, so reflexive in clinical settings, that it's easy to overlook the long-term risks. Many patients have likely received scans with little to no discussion about the radiation involved or its cumulative impact over time. It's even more troubling to learn that some of these scans may not have been necessary at all. According to the study, a notable portion fall into the category of low-value imaging, providing minimal clinical benefit relative to the radiation risk they introduce. What's more concerning is the wild inconsistency in radiation dosages from one scan to another. The same type of scan, for instance, a brain scan, can emit anywhere from the equivalent of 200 to 1,600 dental X-rays, depending on the facility and the operator's choices. Similarly, an abdominal CT for suspected kidney stones might result in a dose as low as 100 or as high as 8,000 dental X-rays. This variability isn't due to the machines themselves, but to the lack of standardized guidelines and oversight regarding how much radiation is truly necessary for each scan. One-third of scans in current testing exceed proposed safety targets, indicating that far too often, patients are subjected to unnecessarily high radiation exposure without being aware of it. Despite its many benefits, CT imaging remains a double-edged sword. The same powerful diagnostic clarity that makes it indispensable in emergencies is also what makes it dangerous when overused. There's no denying its value in detecting life-threatening issues such as internal bleeding, aneurysms, or serious infections, but the line between necessity and precaution is often blurred. In many cases, safer alternatives such as ultrasound or MRI, which do not emit ionizing radiation, might be available but underutilized simply because CTs are faster or more familiar. One of the most alarming aspects of the study is the lack of federal regulation concerning radiation dosage. For an imaging modality that's performed nearly 100 million times annually in the US, it's shocking that there are no enforceable national standards guiding how much radiation a patient should be exposed to during a scan. While Medicare has begun collecting data from hospitals and imaging centers to build a measurement tool, it remains a voluntary and slow-moving effort. In the meantime, countless patients may be exposed to unnecessarily high doses simply due to lack of awareness or institutional oversight. What this study underscores is the urgent need for informed consent and patient empowerment. Too often, patients passively accept imaging tests as part of their care, unaware of the long-term consequences. But in a medical culture that emphasizes efficiency and rapid diagnostics, patients are rarely encouraged to ask the critical questions: is this scan truly necessary? Are there alternatives? What is the radiation dose? And perhaps most importantly, can this scan be done using the lowest possible dose? The answer, unfortunately, is that most people aren't even told there's a dose to ask about. Without routine conversations about risk versus benefit, and without transparent disclosure of dose levels, patients remain uninformed participants in their own care. The new UCSF initiative, Know Your Dose, attempts to bridge this gap by educating the public, but it shouldn't fall solely on patients to protect themselves. Radiologists, physicians, and healthcare institutions must take greater responsibility in minimizing exposure, optimizing skin protocols, and eliminating unnecessary imaging altogether. Even as the American College of Radiology rightly cautions against fearmongering, urging people not to skip truly necessary scans, it's also clear that the current state of CT imaging invites complacency. Statistical modeling, while not direct proof, is often the earliest warning system for emerging public health threats. We cannot wait for a generation of patients to accumulate enough cancer diagnoses before taking action. That would be an avoidable tragedy. The take-home message is clear, and it is not meant to incite panic but to promote vigilance. CT scans save lives, but they also carry very real, measurable risks. With the volume of scans rising steadily each year, the time has come to implement stricter guidelines, demand transparency from providers, and put patient safety at the center of medical imaging decisions. Until these changes are made, the hidden toll of radiation exposure will continue to grow, quietly and preventably.